You will always find a doctor and a nurse here, and they can get their treatment or get some basic medicines here. This building is completely dedicated for Indian students. So all classes here are done on a smart board for every student studying in the class.
Yes, of course, they shouldn't worry about anything because we we have a good attitude to our students, because we know that they are foreigners and they are children, and especially we try to be kind with them and help in any time.
As you can see, we have the latest high-tech mannequins available over here. These are the latest CPR mannequins with monitors and all that stuff we need for the students for the practice.
All type of equipments present here, like microscope, surgiologic scope, and centrifugal machine. Hello everyone, welcome back to our YouTube channel EOCL India, and as per your demand, today I am in UIB Faculty of Medicine, and this building is completely dedicated to Indian students. So now I am going to enter in the building and I will show you complete details related to classrooms, labs, as well as the medical room. And first of all, I want to tell you something, guys. This building is completely dedicated for Indian students. So all Indian students specifically come here, they study, and this building has also all Indian faculties, plus the teachers who are teaching the students, they are also specific for the Indian students. So let us enter the building. So this is the area, and this is the dashboard where there will be always a atrana or a receptionist who generally note down the name of the students before entering the building, and after that the student get the permission to enter the building. So this is the premises, and while entering only you can find the microbiological lab. And if I enter the microbiology lab, you can see the all type of equipments present here, like microscope, surgiologic scope, and centrifugal machine, and this is a automatic centrifugal machine. If you will see these things, then this is microscope, and these are the other equipments. If you will see the numbers are quite good. Like there are nearly 20 to 22 microscope, there are 8 to 10 ovens, plus 5 to 6 centrifugal machine. At the same time, if you will see, the lab are quite limited, having a quite limited strength. The reason is because the mindset of UIB or the policy of UIB is to entertain only limited students, so that the teacher can focus on the student. At the same time, student can also study in a very focused manner. If he has any doubt or if he want to ask something, if the strength is low, then he can easily ask to the professor. If I talk about the lab in charge or the faculty, Dr. Vikas is the professor here, and he is responsible for the maintaining the lab as well as teaching the student the subject microbiology. So you can see the lab is quite big, and all the equipments which are necessary for study microbiology all are present here. As you guys has seen, like all the professors, like, or the lab in charge, they all are completely Indian, like Dr. Vikas or some other faculty. These faculty are completely responsible, and as I said that the building is completely dedicated to Indian students. So all the professors teaching here are Indian, and all the students studying here are completely Indian. So this is another lab. This is biochem lab. If you enter the lab, you can see the clean as well as complete premises of biochem lab. These are all the microscopes present here. These are funnel, these are droppers, and these are oven. This is water bath, and this is old style centrifugal machine where we used to do centrifugal process. This is advanced and modern automatic centrifugal machine. And these are microscopes and chemicals, reagents. So basically, if you will see the lab is quite well built and all type of equipments present here. Plus, this lab is completely dedicated for Indian students, and at one time only 15 to 20 students are only allowed here, so that professor can focus on the student as well as the student can also study peacefully. If I go ahead, you will find anatomy lab or anatomy room. This is the room dedicated to teach the students lectures related to anatomy, and this is a high-tech lab. So all classes here are done on a smart board for every student studying in the class. Like if you will see the subject here, it is related to colloidal solution where centrifugal processes done. This is indicators. Teacher is teaching about indicators which generally shows acid or base. So this is the class. On every desk there is a separate desktop for every student so that he can use it for study purpose. If I go little bit ahead, then we find the anatomy room. So as a student enter in the first year, they are quite unaware of using the cadaver. So that's why these are all 3D models present related to all the human body parts. So students come here, they interact with these models, and using these models, they understand the things. Like if you see, this is the respiratory system, this is the gastroessential system, and this is a human body, and these are abdominal sections. This is a human skull, and this show the woman womb with a body with a baby, and this is a 3D structure of a feet. So if you will see, all type of human body parts are present here. This is a heart showing all type of lymph. So everything is quite present here, and the student studies these all things and get themselves comfortable with the human body part. So after studying all these things, they become quite aware, and after that they start using cadaver in their later stage of education. So this is a quite well built anatomy lab present in UIB Faculty of Medicine. As we come out of the anatomy room, we find a medical room near to the anatomy room. Here, like if any student is feeling dizziness or certain problem, he can come here. You will always find a doctor and a nurse here, and they can get their treatment or get some basic medicines here. So these all are facilities that are provided you at UIB Faculty of Medicine, and these are well built, and the main agenda or the main motive of making these classrooms quite small at the same time present everywhere in a large quantity, because we want that if the students are present in large number, they will be subdivided in small sections, small groups, and each teacher will need to focus on 15 to 20 students maximum at a time, so that he can deliver the lectures well to the student. Student can understand all the things with quite ease, and if the student has any doubt, he can easily ask to the teacher. So these all things increase the focus of student and made the student ease as like they are studying in India. So all these things are well built and built as per the choice of Indian student. So I have shown you all the infrastructure or all the classrooms, labs related to UIB Faculty of Medicine. And believe me guys, like I had not seen a university like this, because I had covered lots of universities visiting different countries like Russia, Kazakhstan, Uzbekistan, but this infrastructure is quite unique. The infrastructure is completely based on focusing Indian student, and that's why UIB Faculty of Medicine, collaborating with EOCL India, has provided all the necessary things that are required for an Indian student to become a good doctor, like Indian faculty, simulation center, high-tech labs, plus standardized FMG coaching, plus focus to every student by allotting small groups of teaching or small groups during their lab. So all these things produce a very comfortable, very focused environment where an Indian student can come and complete their medical education in quite a ease. So this is quite a great infrastructure, and I recommend you guys that you can surely take UIB Faculty of Medicine as your first priority during looking for MBBS abroad. So guys, now I'm going to enter the simulation lab, and here we will show you all the equipments present in simulation lab, and a very great and opportunity for all the students seeing this video, that we also have Adil sir with us, and he is quite renowned anesthesiologist here, and he practice also, and at the same time he is also faculty here in UIB Faculty of Medicine. So hello Adil sir, how are you?
Welcome. Thank you.
It's a great pleasure to meet you.
Same here.
So please introduce us about the lab and the mannequins here.
Okay, my name is Dr. Adil. I'm MD Anesthesia, and I'm a faculty member here in UIB International University. So here, as you can see, we have the latest high-tech mannequins available over here. So you can see, for example, here, let's say we have this intramuscular, intravenous mannequins. We have mannequins for, ear and all that things to check. These are the latest CPR mannequins with monitors and all that stuff we need for the students for the practice. Here you can see we have a special mannequin as it's needed for the medical students for auscultation, for heart sounds, lung sounds, all of that. We have that. We have spirometers. We have all the things, all the equipments, all the mannequins which are needs. For example, we have this ECG. We have like the the mannequins where students can come and intubate the learn how to intubate and how to put the Foley's catheter. In short, we have everything available that's needed for a student. Thank you.
So like how these things or how these modern equipments make UIB a better place rather than comparison to other colleges present in Kazakhstan?
Besides like when a student comes to joins the university, so it's not always that he can go and directly to the hospital and see a patient. Here in the beginning, firstly we give them the experience of studying on the mannequins. Yeah, they can come here. We teach them on the mannequins. We make them perfect, and later on they join the hospitals and see the real patients, and on that they further they deal with them.
Okay, thank you, sir.
Thank you.
So as you can see, this is the lab, and you also got opportunity to meet Adil sir. So this is the mannequin lab, and here all the things are taught to the Indian student. After that, they become ready so that they can go to the clinics and they can practice or they can do their internship. So you can see all the things are present here. They are quite high tech, as well as everything is here as per the need. So these are the things that made UIB Faculty of Medicine quite a great place for the Indian students to complete their MBBS studies. So guys, currently I am near the HOD office of UIB Faculty of Medicine, and today I am going to meet with the HOD, and we will know about the vision of the college as well as why UIB is better place for Indian students. So let us enter. Good morning, ma'am.
Good morning.
So we have HOD ma'am with us. Hello, ma'am.
Hello.
So ma'am, please share us about the vision of the college. Like, what is the vision of the college in relation to MBBS medicine?
The first we can say about our lab rooms, and also we have different agreements with the other hospitals where our students from the India can maybe have lessons with our teachers. Also, our teachers, they do speak English well, because they have a good experience teaching Indian students. And also we have permission to show to our students some clinical cases also in different hospitals. And even though in our university we also have some simulation classrooms where they can practice.
And ma'am, there are many other colleges present in Kazakhstan where Indian students enroll here. But I have seen the FMG result of UIB Faculty of Medicine is quite good. Like the students who are studying here had done great in examination in India. So what is the reason behind it?
Also, recently we had some agreement which related with FMG, and that's why I think it's one of the benefit for Indian students, because they can pass their exam after graduating in our university. And we know that we only one university in Kazakhstan which have this agreement. That's why I think it will be good like profit for our student for their future also, because they will prepare it for their exam, and we will also take some material from this end. Also, our university has more experience than other universities, like working with Indian students.
Okay, ma'am. And one thing more, ma'am, like many students who come here, they are quite new to the studies and they had come abroad first time. So many times there are some hesitation in the mind of the student. So they interact with teachers less, and due to which their scores in the examination start getting down. So what is the faculty or what the institution do to uphelp the boy or the student in their studies?
I think the first we have also how to say, the person who works with our students. It's like a vice dean, and also he can solve any problems of the students. He keeps in touch with students even 24/7. And if our students, especially if they are foreigners, that's why they can have some issues in our country, they can solve it, because this human can solve any problem, because he know their local language and also our language also. That's why I think there are no any other problem. And also we try to communicate with our teachers. They try to give the good knowledge for our students.
Okay, ma'am. So, ma'am told us about the vision of the college as well as why the student studying here quite do well in the field of FMG and medicine. So, ma'am, do you have anything to say to the Indian students or the Indian parents who want to send their children in UIB for study of medicine?
Yes, of course, they shouldn't worry about anything, because we have a good attitude to our students, because we know that they are foreigners and they are children, and especially we try to be kind with them and help in any time.
Okay, ma'am. Okay, ma'am. Thank you. Thanks for giving your
Thank
precious
you.
time.